Hello, my name is Dafina Felix, and today I will be talking to you about a student of mine, a client of mine, rather. This is my first case study of the course. So, this client in particular is a 4-year-old male, and he has been diagnosed with autism since he was 2. He's never had ABA before, but he has been in an inclusive classroom. He has one new sibling, a newborn that was just born a couple of weeks ago, actually. And both of his parents are involved in the process in his life and whatnot. Yeah, so we're going to go into the deficits of this kid. So he is what we consider a lower functioning kiddo. He has functional communication deficits where he can emit a couple of words in his vocabulary, but for the most part, it's very minimum. So we are incorporating the use of PECs into his treatment plan. So yeah, he has self-management difficulty with self-management skills, transitioning, functional play skills, and expanding outside of his special interests, as well as receptive skills, tacting, matching, and imitation in gross and fine motor. Okay, so we were able to pinpoint these deficits based off of the VB map assessment and also the functional behavior interview. So we're going to get into both of those right now. So for his VB map, after the completion, he had deficits in all 9 categories, and he wasn't able to move to level 2 because there wasn't a portion where he received all 5 points for each prompt. Level 1 is where normally neurotypical children from 0 to 18 months would typically be functioning. So this is why we are considering him lower functioning. This assessment was chosen due to lack of skills and prior experience in ABA. So once his skills grow or he ages, he will be moved to an assessment that is more suitable for his independent and adaptive skills. But for right now, we're going to start him off with the VB map. Um, in the functional assessment interview, it was identified that there were no of other diagnoses or medical problems. He was, like I said, in a preschool where it was inclusive, and in this environment, he was basically all of his problem behaviors were reinforced due to like lack of ability to cater to him. So yeah, we have a task on our hands, and I am very looking forward to seeing how he can grow and expand, so he can move on in this portion of his life. But he does eat a variety of foods, so there was no problems with eating, which is really good. He drinks fluids willingly, so that's also really good. The parents had they don't mind if he eats with his hands, due to like the cultural, social aspect of his life. So it's okay for him to eat with his hands. We didn't program anything that had to do with eating utensils, and because it's appropriate for his lifestyle. He does engage in aggression behaviors towards others. He does this thing where he mimics behavior. So if he sees one of his peers acting aggressive, then he would do it because he sees the impact that it may cause. So it can, which leads us, we will get into further about the functions of his behavior later on. But yeah, there was problems with his toileting. He does occasionally have accidents, and he doesn't independently man to go to the bathroom. Um, and that was identified in the functional assessment interview. Um, Transitioning is extremely hard for him, and that is where most of his problem behaviors occurs. Like once it's time to transition, then we see an increase of behaviors. He has low vocabulary, as already mentioned, and they were very concerned about the intensity of his problem behaviors because it could be very dangerous, especially given in the environment. There's kids that are younger and older. He has a new sibling, so that could be very detrimental to target, and that's why they disclosed it in the functional assessment. The functional assessment interview was taken through questionnaire as well as a no, it was an hour. It's an hour meeting where we get to read the questionnaire and kind of go over each question as it pertains to the client and get a further sense of what is socially acceptable, socially, like what are they looking for in a result of the ABA. So yeah, so we're going to go into the programs that are selected based off of the functional assessment interview as well as the VB results. So the programs that were selected target each of the 9 domains as well as the social significant the social significant, I don't want to say struggles, but deficits that his family brought into play. So his toleration goes. So the way that the BCBA programmed it, she wants to build his ability to transition to non-preferred, and these were, of course, in a 6 month short-term goal. So she expects him to be able to make some progress in these deficits in a 6 months. So some of them can be a little high, but just keep in mind that it is for 6 months. Okay, so the transition goal, she wants him to be able to transition from non-preferred places as well as denying access to preferred activities and preferred items. And she wants to increase his ability to wait. The functional communication, because he is able to emit some type of vocal commands, she didn't want to just only focus on pecs and still kind of incorporate the vocal man so we can build on it. And of course, when you're implementing pecs, you're doing it vocally as well. So yeah, so she put that in there, and a listener responding goal, 1-step instruction, filling target, so he can get the skill of being able to answer when it's being spoke to or follow the directions when being spoken to. Matching, she wants to incorporate puzzles, unidentical and identical items. Both of those were 3D items. I accidentally put 2D, but both of them were 3D items. Imitation of gross and fine motor. She wants to work on his social skills for parallel play for 3 minutes. That seems kind of high, but like I said, this is a 6 month goal. And greeting through eye contact, wave, or vocal. She just wanted to give a variation so they're not like making it so aversive, and joint attending by handing a peer an object. So she also incorporates some caregiver goals, which would be toileting data every 2 hours, making sure that they're utilizing antecedent strategies for transitioning, such as timers and priming, and utilizing and document the number of times that he is functionally communicating via PECs. The problem behaviors that were discussed are flopping, crying, aggression to others, disruption, property disruption, and elopement, screaming, and throwing items. Okay, so we weren't able to do a formal functional behavior assessment so far. So what she had is have the behavior technicians take ABC data. So with this data, we have identified the functions of the problem behavior. So for flopping it is escape, aggression, it is access to tangibles and escape. Crying, it is attention, escape, and access to tangibles. And property destruction. I don't know why it says disruption, sorry. It's access to tangibles, escape. Elopement is escape. Screaming is attention and escape and accessible to tangibles. And for throwing item is access to tangibles and escape. We had gathered that, like I said, through ABC data. My time is running out, so I do, however, look forward to working with this client and seeing how he progresses within the next few months. Alrighty, y'all have a good one.